Hello, my name is Joy Tehran, and I'm an OBGYN that works in a large public health clinic, and it's geared toward aiding women who are suffering from infertility. And so I'm a reproductive specialist, and I've worked with women who have had infertility issues for about 2 years now, and whether it's like a full checkup, full examination, or like a full treatment, women are able to be helped and informed properly whenever they walk in. And so polycystic ovarian syndrome, or PCOS, as an abbreviation, is a disease that I've seen about 23 times in 209 patients over the past year. It's a very serious disease, and it causes a lot of uncomfortable and most of the time painful symptoms, and so it is important that they get treated. And some of the treatments can be natural, or they're also like hormone therapies or birth control pills that can help with some of the symptoms. Like fish oil pills or birth control pills can help with ovarian cysts. And for more severe symptoms, you can also go on hormone replacement therapy to keep the hormones regulated the way they're supposed to. And that will help with the symptoms and how the disease kind of goes. So, if the symptoms do continue or they are really severe, and if only maybe one ovary is affected, or it could be both, I would suggest getting an oophorectomy, which is probably like the most effective way, I guess, to get rid of the symptoms if it's caused by just one ovary, or like for sure originating from one place. However, I usually recommend the more natural things like fish oil pills or tea tree oil or exercise for some of those symptoms like acne and irregular menstrual cycles and obesity, and so, or weight gain. And so those are some of the things that I usually get people to go to, but if for the more severe symptoms, I would definitely suggest going on hormone replacement therapy or getting an oophorectomy. And so lifestyle change will also have to happen, because if they're doing hormone therapy, they'll probably be taking pills or some sort of medication to just regulate those hormones, and that'll be implemented in their life. Or if they need to add more exercise, or just add more exercise or anything like that, they will need to implement that into their daily lives. So my patient is a married 25-year-old female, and she's of Hispanic ethnicity and from a lower middle class family. She's had issues in the past with just ovarian cysts and things, but her parents just didn't feel compelled to take her to the doctor since they weren't severe symptoms yet. However, they did take her one time a year ago, or 2 years ago, that the doctor told her that she may have PCOS, and so she came here saying that she's had symptoms for a while, but they've been getting worse over the past year or so. And so after doing an ultrasound and checking her out and examining her, I diagnosed her officially with PCOS, and so I suggested, since symptoms were getting more severe, that they just put her on hormone replacement therapy as soon as possible, just to be able to keep those things at bay and keep the symptoms at bay, and just help her just feel better and be able to do well in her college life and just in her personal life as well. PCOS is a very serious condition, and I feel like it's not talked about enough. However, it definitely is on the rise as a topic of conversation, but I think there could definitely be things that could be done to just increase that talk. Like there could be seminars or sessions in college campuses or even high schools where they just talk about PCOS to the women or the girls that go there in order to look for like the symptoms and the signs, because a lot of times many women have PCOS and they don't even know it until it's just like too late, and they've lost fertility, or they've just dealt with all these symptoms that they think could be just from like menstrual hormones or just like from stress, when in reality they have this condition that can actually be helped and like kind of prevented. And I think something else that could be really improved is there can be more information, just more studies to be done to find maybe the cause of PCOS, because the cause is unknown, as you may know. And yeah, just to get more studies and more information out of how they can treat it and how they can catch it early on so that it has the least effect, or the least, it affects them to the least or in smallest degree. And that's all.